Good evening, everyone, and thank you for tuning into our latest Ask the Leaders Facebook Live Q&A. My name is Paula Widdowson, and I'm the Executive Member for Environment and Climate Change. Some of you will already know that the Council has held a number of Facebook Live sessions now, covering a range of topics from the latest public health advice to the reopening of the city. Today, we are once again joined by representatives from the public health sector to discuss what the latest restrictions mean for residents and what support is out there to help us get through this uncertain period. Before I go on to introduce tonight's panellists, I'd like to once again thank everyone in the city, residents and businesses, for their incredible efforts in driving the virus down across York. This year has been exceptionally difficult for everyone, and it's clear that with the festive season upon us, the next few weeks will come as a challenge to many. Whilst this year's holiday season might look slightly different, I know we will all continue to look after one another, as we have throughout the year. I know that a lot has been asked of everyone in the city, and we are extremely grateful for your hard work. As a council, we are here to support you as best we can. Our community hubs are still running, and anyone needing support can contact the coronavirus helpline on York, which is 01904 551 550, or email covid19help@york.gov.uk, where our incredible volunteers and staff will be able to help you, whether you need assistance with collecting shopping or simply need advice on what the restrictions mean for you. With the national lockdown restrictions lifted later this week, we will all be able to once again visit York's fantastic array of shops, and with Christmas in mind, I would strongly encourage all residents to shop local and support our business community through this difficult period. Although the coming weeks will continue to present new challenges for all of us, it's crucial that we continue to work together and support each other. Now I'll stop there because I have gone on a bit and ask the panel to introduce themselves. Mike, can we start with yourself?
Yes, good evening everyone. So my name is Mike Holmes. I'm a GP at Haxby Group Practice in the City of York, and I also chair an organisation called Nimbus Care, which is an organisation bringing all the GP practices to work together when it's in the best interests of the city and its population.
Many thanks. Kath?
Sure. I'm Kath Davies. I'm a consultant clinical psychologist working with TEWV and with Valley, and clinically I work with children and young people.
Many thanks. Sharon, would you like to introduce yourself?
Good evening, everybody. I'm Sharon Stoltz, and I'm the Director of Public Health for York.
Thank you. And Denise?
Good evening. Yes, I'm Denise Craghill. I'm a councillor, executive member for Housing and Safer Neighbourhoods.
Many thanks. So for those of you who haven't watched one of our Facebook Lives Q&As before, and I'd be surprised because we've done quite a few of them, we've a number of questions that have been submitted by residents, and I would like to thank those who have submitted their questions in advance. It gives us time to prepare and make sure we've got all the relevant details. We'll begin by answering your questions, but please don't forget that you can ask your questions in the comment section as we go on this evening. Firstly, though, I'd like to turn to our Director of Public Health, Sharon, to give us an overview of the situation in York and the guidance on Tier 2 restrictions. Sharon, over to yourself.
Okay, right. So just to start with some figures then to give everyone watching an understanding of where we are. So since the pandemic started back in March, York has had over 5,500 cases of COVID. Our cases peaked in the end of September and early October, which is the reason why we were put into Tier 2, and the high tier before the most recent period of national restrictions that we've been experiencing. But since then, our rates have consistently been falling across all age groups. And now for a number of weeks now, our case numbers have been lower than both the national and regional averages. So our latest figures, latest 7-day case rate is 106 per 100,000. That's considerably lower than the national and regional rate. And our positivity rate, that's the number of tests that are coming back positive over the last 5 days, we've done really, really well, and that is now down to 5.8%. So that's very close to our goal, which is to get below 5%. So I'd like to echo Paula's comments at the start, really, to thank everybody across the city. You know, all the businesses, residents, everybody that's worked together to bring those case numbers down. That's really, really positive. In terms of the Tier 2 restrictions that will come into play from Wednesday, rather than rattling through all of those now, it would be helpful, I think, for people to either go to the national government website, so that's gov.uk coronavirus, or I would encourage people to go on to the council's, the City of York Council's website, because there's lots of really useful information there and links to the national guidance, rather than you having to search on the government website for guidance. There are some very helpful links on the council's website as well. And if you have particular circumstances where you're reading the national guidance and you think, well, I'm not quite sure how that relates to me, then you can contact the public health team, the local public health team, on the inquiries mailbox, and Chris, who's supporting us with a meeting today, will be able to put that email address in the chat for you to read, and that can be very helpful for those people who, when you read the guidance, you can't really tell whether that affects you or your business. So please do make use of that facility to get bespoke public health advice to your situation as well. So I'm conscious that there have been a number of other questions that will cover some more of the detail that people have asked for. So I'll probably stop there, Paula, and deal with some of the pre-submitted questions.
Okay, let's get on with the questions. And I know the first one is directed at yourself, Sharon, as you know, about the tiers. And also, Denise, I'd like to bring you in about the antisocial behaviour angle on it. So, question that we've been given is, or has been submitted, given that York is in a much better position than neighbouring cities and urban areas, what will be done to protect York and its residents if we became the first city in the North East Yorkshire to enter Tier 1? It is inevitable that this could lead to many travelling from Teesside, Hull, Leeds, Scarborough, etc. to go to our pubs on the weekend. This causes more than enough of an antisocial behavioural problem in normal times. So Sharon, what's your take on that one?
Well, it's an interesting one, isn't it? And we had a similar question at the Q&A session we did on Friday. There are a couple of elements to this, I think. People who are in Tier 3 areas are obviously discouraged from travelling into lower tier areas, but that doesn't necessarily mean that people won't travel into areas like York that are in a lower tier. So there are a couple of things I would say about that. One is that we've worked hard as a city together with businesses, including pubs, restaurants, shops, etc., to ensure that York is a safe place to be. All of our businesses have got COVID risk assessments in place, where they've needed guidance on those risk assessments, either from the council's public health team or environmental health team, we've been able to provide them with that guidance. And where there have been whistleblowing reports, or people have contacted us to say that they're concerned about a particular business, we've been able to go and work with that business and help them to put safety measures in place. So I am hugely reassured by that even if people do travel into York from outside, our shops and restaurants, etc., are safe places to be. And that will help spread the virus. Our businesses have also been very good at not taking bookings from people from outside the city as well. So if we're thinking about people booking to come to a restaurant, for example, our businesses have been very good at asking where people are travelling from, and if they're travelling from a tier 3 area, then we have examples where businesses have been turning down those bookings as well. So a lot of work has happened to ensure that the city is safe, and I hope that's very reassuring for people.
No, that's extremely reassuring. Thank you ever so much. Now, Denise, I know that you're one of the Guildhall councillors, which means for anybody like me who's only been around for 26 years in the city, means the city centre. So you have quite a lot of experience from the antisocial behaviour angle, and I know there is a lot of fantastic work that goes into your area. Would you like to share that with us?
Oh, well, yes, you're right. Guildhall Ward does include most of the city centre. It includes other bits as well, but it does include areas where a lot of city centre residents live alongside our wonderful city centre businesses. So yes, I think the main thing about the work that goes into it is that it's work that's done in partnership, and I think this was mentioned as I understand, in the last Q&A as well, but the importance of us all working together in partnership on this. So we've appointed 4 new COVID marshals recently under the government's COVID funding, but we also have the bid rangers, we have the council's neighbourhood enforcement officers, and we have our team of public protection officers, and all of those people work closely together, and of course work very closely with the police. So I think that continued close partnership working is going to be really important in this whole situation. I think, as Sharon alluded to, the rules about the tiers, if we can enforce those rules, do help quite a lot. As I understand it, people who are travelling, say, from a tier 2 area into a tier 1 area, if we did become that, are still supposed to stand by the tier 2 rules. The difficulty is judging who those people are and where they're coming from. So a lot of judgment will have to come into this, but it will be done by ever closer partnership working between all those people that I've mentioned, and and the businesses themselves as well, being very responsible and being part of that.
Good, a full answer, and I knew you'd have an absolute handle on all of that. Sharon, yet another one for yourself. Why is York in tier 2 when we have seen a large drop in the R rates, and have York's case numbers continued to fall, which I think you've covered? And when will York come out of tier 2, which I know you've alluded to?
Yeah, so I suppose first to say that this is not a decision that we make locally. It's a decision made by government on advice from the Joint Biosecurity Centre. So the JBC was set up by government as part of the pandemic response, to look at the national data of what's happening with coronavirus across the whole of the country, and also to look at travel flows from one area to another and all of that information, really. So when they made a decision which tiers areas would be put into, they looked at 5 key indicators. They looked at the case detection rate, so the rate of COVID cases, which I explained a few minutes ago, has been coming down in York since about mid-October, and that continues to fall. They look at what's happening with confirmed cases of COVID in different age groups. So they're particularly interested in what's happening with the over 60s. And in York, we did have an increase in cases in people over 60. That's now starting to fall, but that will have had some influence over the government's decision as to which tier York went into. They then look at whether cases are rising or falling, and the rate of cases rising or falling. They look at the positivity rate, but they also look at pressures on the NHS as well. And York sits as part of a wider health system, which is across Humber, Coast and Vale. And so when you look at the whole of the health system, York is doing better than the rest of the region. If we look at what's happening in Scarborough, in the Humber, in East Riding and some of the East Coast areas, they have seen dramatic increases in hospital cases, and we know that primary care is very busy as well. And so all of those factors are taken into account. And then the other issue, which we believe happened, is that rather than looking at individual cities, the government looked at areas. And so York is part of the North Yorkshire area. And so we, with North Yorkshire, were put into tier 2, rather than just looking at, you know, what was happening in York as an individual city. What I hope will happen is that as our numbers continue to fall, that will be reviewed again. The government will be reviewing the tiers on the 16th of December. So we will find out that then whether York is remaining in tier 2 or whether we'll go into tier 1. I'm not a betting person, but if I were, my best guess is that the government won't make any dramatic changes to tiers before Christmas, and that we may well find ourselves changing tiers when they're reviewed again after New Year, which is what I suspect will happen. But because these decisions are made by politicians on public health advice, obviously I might be wrong, and we may find ourselves going into tier 1 based on our data at the moment. But I wouldn't want people to get really excited about that and to depend on that just in case we find ourselves still in tier 2 until until the new year.
That's a very full answer. We've had a couple of questions through on the chat, so I'm just going to go to the second question first, and then I'm going to change the topic slightly so that we go on to schools and students and come back to more of the restrictions, just so that we give you a bit of a rest, Sharon. Yeah. So the question that we've had through, Lewis has asked, could a residency scheme be introduced to stop people coming from higher tiers to use hospitality if cases continue to decrease in York? Denise, I think you and I can answer that one because we've had many a discussion across the council. Last time I checked, we are advised to stay at home, but we cannot arrest people for coming from Leeds to go into York. What are your thoughts on it, Denise?
I think my thoughts are similar. I entirely understand where the question's coming from. It's a thought that comes to mind, but it has been discussed quite a bit now and again over recent weeks or even months, and it's not really a very practical. When you try to think about how you could implement it, it is extremely difficult. And obviously there are people who work in York who live outside of York, and the rules, you know, say that you can move around for work, you can move around for education, and it would be a very challenging thing to implement, really.
Absolutely. So Mike and Kath, I've got quite a few questions about schools and children and a little bit about emotional well-being. So could we start? I think the best place to start for these questions is on the emotional well-being side for whatever age group. Mike, do you want to let people know what is available across York?
Yeah, thanks, Paula. I mean, I think the first thing I would say is that, you know, from my perspective as a GP in the city, I think emotional well-being is such an important aspect of the pandemic. You know, we've been in various stages of lockdown since the springtime, and it is beginning to take its toll, and we're seeing that in the way people present to us in general practice. And I think there's various levels of advice that we would offer to people who are beginning to struggle. And one of the best resources I can point you to is something on the NHS website called the 5 Ways to Wellbeing, and it talks about things you can do very straightforwardly to help look after yourselves. So let me whiz through them really quickly. So one is connect to other people. So keep those relationships. And I know it can be difficult in lockdown, but we know we can exercise with others. We know we can connect to people on things like Zoom and other social media platforms, and they really do have value. We've talked about, the other thing is staying active, physically active. We know that exercise is really important from the point of view of well-being. In my practice, we did a survey of our patients during the first lockdown, and it was really encouraging to see that the amount of exercise that people were taking was actually going up, which was great to see. The third one is about learning new skills, developing hobbies, things like cooking and decorating, painting, reading, whatever it is. But it's really good just to occupy your mind and learn new things and feel good about yourself. Fourthly, give to others. And of course, that can mean volunteering and working with charities and looking after people who in your community that you may feel are vulnerable. But it also may be just saying thank you. It may be just telling family members that you love them, that you care about them, and simple things like that can make a huge difference. And then the last thing they talk about is paying attention to the moment, sort of trying to push distractions away. Maybe don't listen to the news that much. Focus on what you're doing. And that can be referred to as mindfulness. And it really can be helpful. And there's lots of information on the internet if you Google mindfulness. But there's sort of 5 tips that the NHS are promoting. And I know there are some local schemes, Feel Real York, Live Well York, with associated websites that you can go to get further information.
So that's the 5 Ways to Wellbeing, and it explains why I've stopped listening to the news. I only listen to bits and pieces of the news. I used to be a real news junkie. I would have it on for Radio 4 in the morning all the way through till the last one in the evening on the BBC, on the TV. I listen to one set a day now, and that's about as much as I can actually take in and process. So thank you ever so much for that, Mike. Kath, you've got a specialism towards our younger residents. Would you like to talk through how you think we can make sure... Oh, we've lost her. Okay, never mind. We'll come back to Kath. She's disappeared in a puff of smoke when I ask her a question. I'm obviously going to have to change. But I thought you just didn't like my perfume anymore, Kath. You disappeared for a moment.
Yeah.
So if you could just let us know how we can support children.
Yeah, sure. Sorry about that, Mike. I did hear some of it, but my my interweb seems to not be so good here in sunny Leeds. So I promise I won't come and visit York. What I would say is I'd echo everything that I heard that Mike said. Really, you know, I think this is a challenging time for everybody. You know, for some, we know that for some vulnerable groups, it's been more challenging than others. And I guess and there's Live Well York and Every Mind Matters and Feel Real.
You keep fading in and out.
In terms of children and young people,
Kath, I think
There
we're going to have
is
to ask you, could you
my
turn your
internet at the minute. It's open
screen,
final day.
if you turn your video off, sometimes it works better and we might be able to hear you better.
Yeah,
Would you like to try that? Right, go for
Done
it.
that. Is that any better?
Perfect, can hear you better, loads
Okay.
better.
Cool. In terms of young children and young people, so there are again, I think those 5 steps that Mike talked about, also really, really important for young people. It is important that through school and education, they do maintain some of those social relationships that were so disrupted in the first lockdown. There are some online resources such as TEWV, which is a free digital test themselves. There's the Recovery College online through TEWV that's got lots of resources around COVID for young people and maintaining good emotional health during that time. You know, and I think the other time for young people, it's often a challenging time for everybody in the family.
Okay, I think we're going to have to leave it there, Kath, because you're
so
starting
again,
to sound,
I would,
Kath,
you know,
you're starting to sound a
emphasise
bit
what
like
Mike said. The really important thing.
Kath, you're starting to sound a bit like
a
Dalek.
A robot.
Yeah.
Okay.
So I'm going to mute you. So apologies, that is me doing that. So apologies for doing that. Bring your camera back on and then we'll bring you in and out and see if it's, because sometimes it just sorts itself out, the internet. My famous one is turn everything off and on again. I think you've already tried that. Question that I've got through from Debbie on the chat is, will schools close a week early so children can work from home so that they can protect the elderly and the vulnerable in the run up to Christmas? Sharon, that sounds like one for you.
So the government isn't going to make any ruling that schools should close early. But that doesn't mean that individual schools themselves, through discussion with their school governors and in consultation with parents, etc., won't make a decision to close early. My understanding at the moment, though, is that York schools are not intending to close early. I think they recognise that children have already missed out on such a lot of school this year. And that even though they can't celebrate the festive season in the normal way with, you know, big school assemblies and big school parties, within the COVID rules, they are still trying to make Christmas special for children, and some are planning nativity plays and other ways that they can celebrate the festive season. So it'll be down to each individual school, but my understanding is no, they'll be finishing school at the normal time.
Okay, thank you for that. That's nice and clear. There is a follow-up one on that, is, do you know, I think they think you're psychic. I'm very impressed. What are the plans for the start of January term for York schools and universities, given we're in Tier 2?
So my understanding is that schools, colleges and universities will be back as normal in January. Even if we're in Tier 1, it doesn't make any difference in terms of the COVID secure measures that schools and colleges and universities will be using. We've had very few outbreaks in our schools. And the universities have got really on top of the spread of the virus in university settings as well. So they're safe places for our children and young people to be studying, and so there isn't any reason for them not to open. In terms of universities, I'll very quickly say something about testing. So everyone will be aware from the national media, etc., that students are being offered testing to see whether they're carrying the COVID virus before they go home for Christmas. We're in discussions with the universities about planning for students coming back in January, and the best way of offering students tests before they come back as well. So I fully expect there to be a testing offer in place for all university students, and we'll have firm plans in place by then.
Fantastic. Mike, I know that you've got a lot of expertise in this area, particularly about vaccination and testing. Could you expand on what Sharon said?
In terms of testing, well, I
testing
think
and vaccinations.
Yeah. So, well, let me talk about vaccinations first, and then I'll come back to testing. So, there's clearly two really important priorities for us in terms of vaccinations. There's the flu vaccination program, and then there's the newer COVID-19 vaccination program. So, the flu vaccination program has already started. It's been underway for a couple of months now. Up to now, it's primarily been delivered by GP practices and by community pharmacies, and it's really focused on the higher risk people in our communities. So we know that flu can be responsible for over 10,000 deaths per year. We sometimes forget that nationally, and it's therefore a really important condition that we need to think about. And the vaccination program is really effective, perhaps this year more than any other year, because what we want to do is protect our hospitals from those patients who potentially would go in with flu. So we've been vaccinating the high risk patients, people that are over 65-year-olds and those with long-term conditions, and we've done really well as a city. I think we've vaccinated for our over 65-year-olds. We've already vaccinated over 80% of our population, which is fantastic. We've now got a mass vaccination site, which is down at Moor Lane, near Tesco's at the bottom of Tadcaster Road. I'm sure we've all passed it, and that's working now, really working well. And we're about to, from tomorrow, start vaccinating the next cohort of the population. So the 50-year-olds to 64-year-olds are eligible for a free NHS flu vaccine from tomorrow, and they can book in to have that at the Moor Lane site. In terms of COVID vaccine, I'm sure everybody's seen a lot of coverage on this in the news. Mr. Johnson and Mr. Hancock have been talking about it, and general practice is going to be at the heart of that. So we are now gearing up to do that. And the mass vaccination site at Moor Lane will also be involved in that, as will our GP practices, who will be vaccinating our elderly populations and our care home populations. When will that start? Well, we're still waiting for absolute confirmation of that. There are two vaccines that are being developed and close to being ready. One is called the Courageous vaccine, and that will be hopefully available in the next week or so. It's going through its final testing and final approval as we speak. We're hoping to hear any day now, and potentially that might be available as soon as next week. The other vaccine, the Oxford vaccine, is probably going to be a few weeks behind it, but it still needs to go through the final stages of its testing. So listen out for more information. This will almost certainly come through your GP practices, and as soon as we can start vaccinating, we'll be doing exactly that. And finally, Paula, just in terms of testing, as we know, there are a number of ways we can access tests. For symptomatic people, the main site is through the regional testing site at Poppleton, and you would access that through the government website. There are some availability in practices, although that's limited really for housebound patients and also for GP staff and their families. We're now starting to think about mass testing, and I'm sure Sharon will probably give us more information about that in terms of when that might be available locally.
Would help if I unmuted myself. I've had a question come in from Linda, which I think Mike and Kath, you're probably best placed to answer it. The question is, when do we think, or is there going to be testing for year 10s and 11s in school? And also, how do you keep, building on what you were saying earlier, how do we make sure that we keep those year 10s and year 11s in the right place mentally? Oh, Sharon, do you want to start? Sorry, I was hoping that you were at least catching a breath.
No, well, we're developing our testing strategy as a city at the moment. So as Mike has already mentioned, there are a number of new technologies coming on stream now about testing. And so we have, so what we're now looking at, I think what this question is related to, is really about asymptomatic testing, which is what you will have read a lot about in the press. So at the moment, what we can do already in York is what we call enhanced testing, using what's called PCR tests. That is just a throat and nose swab, but it has to be sent off to the government laboratories, well, the lighthouse laboratories, and you get your result back within 24 to 48 hours. So that testing is already available. It's led by myself and my team, and we will make a decision on whether we need to do that in an outbreak situation. And so we already have that capability to do that in schools now. For the new testing, with the new lateral flow tests, which are the rapid tests that are still a throat and nose swab, but they give a result within 30 to 60 minutes. We haven't got those available to us yet in York. We're pushing the government at the moment to supply us with those tests. We made a decision at the Outbreak Management Advisory Board about 2 weeks ago what our priority groups would be for testing, and care home visitors, students, including pupils in school, particularly secondary schools, were some of our priority groups that we wanted to focus that asymptomatic testing on. So we're getting our plans together at the moment, so that as soon as those tests are made available to us, we'll be able to start doing that testing. We don't have any at the moment, and I don't have a date yet for when we'll receive them. But as soon as we do, we'll be able to start doing that testing, and year 10 and 11 in secondary schools will be our priority, one of our priority groups that we want to focus on.
Okay, that's fantastic, and thank you for a very full answer. Mike, just building on it being students, just the way my head sometimes works, how are we going to look after our international students? Because I know that there's a lot of student movement in the UK, but our international students are unlikely to be going anywhere over the festive period.
So my understanding is they stay in the area and they are all registered with a practice, with our university practice, which is Unity Health mainly, although they're not necessarily restricted to that practice. But they will have a registered GP, and they will have the ability to contact that service throughout the holiday period. And that's true of any holiday period and for any student who stays in the area.
Okay,
So
that's excellent.
I think that's pretty much just service as normal, to be honest, Paula.
Okay, excellent. Kath, have you got anything to add to that?
No, sorry, my internet went out again. I don't know what's the matter with it.
It does keep playing up, but go on. So is there anything that you would say to our international students? I know that Denise will have a comment, because we've got lots going on inside of the city, so that we can help fulfill those 5 ways of well-being.
Yes, to stay in touch through the student counselling services, you know, and so if you are struggling,
we're going to have to mute you again, Kath. It's disappeared again. You're definitely doing
there is help out there. Services are open, so please do approach us.
Okay, Denise, what do you think we could offer them inside of the city over the festive period?
Offer who in the city, did you say?
The international students. In
The
my head,
student,
I've got,
international
we've got
students
all the lights
particularly.
up.
Yeah.
We've got all the lights up so that
Well,
they can come out and they can enjoy a mulled wine or a cup of coffee as they're walking around, and they can see people. What else? There's lots of stuff that we're doing. We're doing different trails.
yeah, I suppose all the things that we're doing to try to make Christmas a good Christmas, even though we don't, have all the stalls and whatever, but we are, as you say, all the lights, the trails, the hospitality of York people as far as we can. And if they are feeling lonely and isolated and wish that they could go home, then it's it's back to all the sort of well-being advice that there is on the Live Well York website and all that sort of thing. And I suppose the baseline for that is, if you're not sure where to begin, if you are feeling isolated and lonely, whether you're a student or someone else, and you're not sure where to begin, just ask somebody. You can ring up the council if you feel you can do that, or just ask a friend to help you as well. And obviously people listening to this probably do use the internet because they're listening to Facebook, but if you know other people who don't, there are lots of different options. And if they just pick up the phone, they can also be pointed towards those things. There were a couple of things I picked out were doorstep natters are a thing that are being offered by volunteers, and conversely, tea and technology is being offered by the University of York to help people who aren't on the internet to maybe get onto the internet. So there's, and maybe international students. I think one of your Mike's 5 ways to wellbeing concept, one of those is also help other people, because that can actually do an awful lot for you and the people you're helping.
I know you want to jump in there, Sharon. There's something that you were saying to do with the universities have arrangements in place.
Oh yes, it's just to say that it's just to say that the universities are well used to international students staying over Christmas. Obviously this year it's different because of the pandemic, but they have put in place practical arrangements. So if anybody it becomes unwell and they can't get out shopping, they've got arrangements that they can get food to them. Student support services will be open, as Kath was indicating. So I think there's a lot of support on campus, but I would absolutely agree with Denise that there's a lot going on in the city that international students will be able to access as well. And we're a very friendly and welcoming city, and so I would encourage students to to take up what the city has to offer as well.
Absolutely, and they can access in the same way as all of our residents, whether they're student residents, whether they're children residents, whether they're adult residents, whether they're elderly residents. They can access all the different parts of York that we know work beautifully well, including all the hubs. And I do know that the university have got several hundred of our volunteers and hubs working with the university to make sure that they're not lonely, that they do have food. And I know that quite a lot of the students are volunteering back into the hubs to make sure that that's given back into the city. So fantastic, builds on everything that Mike was saying earlier. So sticking with the Christmas theme, do you know, Sharon, what the current rules are for the York shops over the Christmas period, especially around Christmas week and New Year's Eve?
So the shops are allowed to open under all tiers. Shops can open, and I read, and they will have all of their COVID secure arrangements in place. I did read something in the press today that the government are thinking about allowing shops to open extended hours, and perhaps shops even opening 24 hours if they want to, so that people can make the most of the shopping time before Christmas. But no doubt the council will receive further information about that at some point. So our shops, including non-essential shops, are open as normal. The main restrictions really are around places serving alcohol. So you're only allowed to, businesses are only allowed to serve alcohol if it's part of a main meal. So that will mean that quite a lot of pubs, unfortunately, will have to close, which is unfortunate. But there'll still be a lot of places open in the city. And I know that businesses are being very innovative in thinking about how they can maximise their outside space. There's a lot we're doing as a council to support businesses with maximising outdoor space. So, you know, for people who are thinking of coming into the city, and I would encourage local residents to come in just to walk around. The lights are absolutely beautiful. You know, the city is still open. We just want people to behave responsibly and make sure that, you know, they're following the hands, face, space guidance, and keeping themselves and others safe and behave responsibly in that way. But the city will still be open, and is going to be a great place to visit and to shop in that Christmas period.
I'd absolutely echo that. I walk around the city probably 4 or 5 times a week, sometimes in the day, sometimes in the night. The city is currently looking fantastic. The lights are beautiful. We've got different coffee bars doing takeaways. We've got different places where you can actually buy the food and take that away. And come Wednesday, the shops will also be open. Absolutely mindful of what you've said, Sharon, you know, hands, face, space. And just cut each other a bit of slack. The one thing I don't know if you guys do the same thing, but I'm playing a game at the moment, which is how often can I get my smiled back at me? So as I'm walking down the street, smile and say hello to somebody. You may not know them, but nobody else may have spoken to them that day. And actually it always makes you feel better if you get 1 in every 3 or 4. All right, the other people may think I'm a bit of a muppet, but it's a really, really enjoyable thing to do. I'm just conscious of time, so I'm going to take the last couple of questions. In fact, no, the last couple of comments. If you could just think about what we've been discussing and give me a couple of sentences on how you would advise people over the Christmas period and whilst we're in tier 2 to get on and crack on and make the best of what is not the best situation at the moment. Denise, I'll start with you because you're always full of lots of ideas.
Oh, thank you very much, Paula. I'm not sure. I suppose I'd reiterate what you just touched on recently, Paula, that people who live in York, to encourage people who live in York to come into both the city centre and I must, with particularly having Councillor Waller's thoughts in mind, say to their local centres as well. Yep. You know, to shop and to support businesses that are able to be open. And, you know, as you said, we have the lights up and we have the usual great atmosphere that of York City Centre has for Christmas, and to really support local businesses, to shop local where you can. Obviously it's tempting to go to the internet, but you know, we have lots of great independent shops, as well as you know, local cafes. Tier 2, yeah, it's fine. So support them where you can, and have a great Christmas.
Fantastic. Mike, what are your thoughts?
Well, I mean, Christmas is such an important time of year, isn't it? And I think especially this year when it's been so tough for everybody, whatever you do, whatever walk of life you're in, it's been a tough year. And I think Christmas is at a time just to sort of have a break, to stop, reflect, to be with your families, to get out, to enjoy our wonderful city. I think, you know, you've both beautifully described what's on offer. I love that concept of supporting local businesses, and that's something we've been really proud to do with the mass vaccination site, actually, because all the infrastructure on that site has been provided by local companies. And you know, it's not just general practice doing that, it's all the health and social care sectors working together collaboratively. And it's been a really beautiful example of York helping York. And I'm really proud to be part of it, and proud to be part of a city that can do that and has done it to such great effect. I think you know, the other thing about Christmas is we have got this little bit of freedom that the Prime Minister's announced between the 23rd and the 27th, where we can come together. And I think it's a great thing. But I think what I would say is just because you can doesn't mean you have to. And I think everybody's circumstances are different. So it doesn't mean this virus has gone away. And I think what it just gives us a chance to do is just think about it and put it in the context of our own circumstances. For some people, coming together is absolutely critical, and you know, they really are looking forward to it, and it'll be a huge boost to their well-being. But for others, there still may be risk. And you know, very quickly, in my own case, my parents are elderly, they've got long-term conditions, and actually we're going to choose not to come together because that we feel the risk. We don't want to take that risk, and that's personal to us. It doesn't mean that others have to follow suit, but my advice is just think about your own personal circumstances, think about that risk, have a great Christmas, and let's hope 2021 will be a bit better.
I absolutely agree with you there, Mike. 2021 is going to be a lot better.
Yeah.
You know, we are heading towards the sunshine again. We're out, getting close to being out of the darkest days. And like yourself, I'm not seeing my parents this Christmas because they're fairly elderly, and I have two sisters who live closer, and therefore it's not reasonable for me to upset the apple cart. So it's all horses for courses, and how you work it through for yourself, you know. But also take it easy on yourself. Nobody's expecting anything at the moment apart from the odd smile. Sharon, what are your thoughts on this? And then we're going to go to closing.
So I would just encourage people to start planning now. If you haven't made a decision about how you're going to manage Christmas as a family. So there is guidance available on how you form a Christmas bubble. You can form a Christmas bubble comprised of people from no more than 3 households. You're not limited as to the number of people that you can meet with together, but no more than 3 households. That advice is on the government website, and there's a link to it on the council's website. So, you know, families are complicated, aren't they? So having those discussions now, as Mike and Paula have already mentioned, about how you're going to manage Christmas safely, thinking about the vulnerable members of your families. If you haven't done that yet, I would encourage you to do that. The earlier you can do that, to stop arguments closer to Christmas,
Yes.
I think is probably the best thing to do.
And also so that they get in the treats you like rather than the one your sister likes. It's much better, much more fun that way around. Guys, thank you ever so much for all of your time this evening. Kath, I'm dreadfully sorry that we couldn't get you in and out on the internet all the time, but we're now going to go, you know, with an eye on time. I'm going to start drawing everything to a close. As I said, I'd like to thank everyone who asked a question today. Certainly been valuable to hear, certainly given me a bit more clarity, and it's also allowed us to hear all the views. We will continue to hold Facebook Live Q&As on other important subjects in the future. In fact, the next Q&A is really focused on Christmas and what you can and you can't do. And I know everybody's expertise will be very much valued there. I'd really like to thank our panelists this evening for giving their time and insight. Very, very much appreciated. Anybody listening, please feel free to continue to leave your comments and questions, and our team will try and get back to you within the next 24 hours. For the future question and answer sessions, the latest public health updates and more of the other topics that we've discussed even today, please follow the Council's social media pages and all the online resources that have been mentioned in tonight's Q&A. Again, thank you for everyone joining us. Thank you to the panelists, and have a fantastic evening and a lovely Christmas.